Welcome to Bold TV. Almost 30 million women suffer silently with menopause symptoms at work. My guest today is Dr. Soma Mandal, a midlife's women's health expert and board-certified internist. She received her medical degree from NYU with a research fellowship at Oxford. She's written a new book called Dear Menopause, I Do Not Fear You. It'll help women live their boldest life during this time. Welcome, Dr. Mandal.
Thanks for having me, Maria.
How are you?
I'm good, thank you.
Well, on my way over here, I read that menopause is slated to be a $3.3 billion industry in 2023. A lot of pharmaceutical companies are looking for treatments. What are the symptoms that most women experience?
That's not a surprise to me at all, because menopause is something that all women go through. So the symptoms can begin as early as your late 30s to your early 50s, and it can start with fatigue, irritability, dry hair, dry skin, night sweats, hot flashes, and obviously a change in your menstrual cycle.
And the definition of menopause is the complete stop of the menstrual cycle.
That's correct.
Right?
So,
and that can also be brought on by cancers.
So the women who go through hysterectomies, total hysterectomies, I should say,
Yes.
where their uterus and ovaries are removed, go through menopause for those reasons.
Actress Angelina Jolie talked about having her fallopian tubes removed and uterus because of the breast cancer, and it forced her into menopause.
That's right.
And she opted for natural therapies. Let's talk about some of the treatments, because that's what most women want.
Yes.
If anybody's watching, that's what they want to know is what do you do when you sweat and your face is red and you're uncomfortable? Get to tell us, you're the expert.
Sure. So not every woman needs treatment. The symptoms of menopause can be very variable, and not everyone goes through, the different things that I just mentioned. There are some women, unfortunately, who have pronounced symptoms. And in those particular cases, I always advise, whether it's my friends or my patients, to really seek the medical care, the medical advice of either their internist or their gynecologist, because they need to, if they are going to start medications, then they need to make an informed decision as to what's best for them.
Although a lot of women, not even some, a lot of women say they go to their physicians and the symptoms are dismissed. They're not taken seriously. I love what someone, I think it's Lisa Stryker at Northwestern Memorial Hospital in Chicago. She's doing something fantastic. They started a new clinic just focusing on this, and she wants to make sure that every family practitioner, every clinician is educated on menopause so women's symptoms aren't dismissed. I mean, what do you say about that?
It's a real shame, and I think that these are things that not every person is aware of. Unfortunately, not every physician is well rehearsed on this.
They don't teach it in medical school.
Of course they do.
20%.
They do teach it, but not in the terms of what it really means. So yes, we sit in the classroom and we learn about all the different hormones and the changes that happen. Mm-hmm. But I don't think there's a significance as to what it really means and what the woman feels as she's going through it. And being as someone in midlife at this point, I truly appreciate it because it's something that we all go through. And whether it's a man physician or a woman physician, I think there needs to be more education about it. That being said, your friends are your biggest resources. So if you are having symptoms and you don't know where to reach out to another friend who may be going through the same thing. Talk to her about who she may be seeing.
That's great advice.
Mm-hmm.
And what about, you mentioned portable fans and layered clothing. Tell us about that, because it actually does help. I've heard people say that they love the little portable fans. Like, wow, they're...
Well, we're taking over the workforce, or trying to, and so with that, there are more women at work, and When I have a woman who comes in, they're like, what should I do? The first thing I say, wear layers. That way you can peel off, your sweater, your cardigan. If it's a shirt that you can take off and wear something lighter, it gives you a little bit more breathing room. Wear natural fibers like cotton that breathe better. These are all things that we all can do. The polyester fabrics tend to hold the moisture in and make you feel hotter than you really should.
What about nutrition? Are certain foods triggers or certain beverages?
Sure. So things like caffeine, alcohol, they tend to make symptoms worse. So a cup of coffee doesn't do much. But if you're having a lot of coffee, more than 2 or 3 cups a day, and you're having these symptoms, then it's time to dial back down.
What else? You mentioned some other natural therapies.
So there are a bunch of natural therapies. Unfortunately, not all of them have been well studied. But the one that is most well known in this is black cohosh. Black cohosh is a plant, is a derivative of the buttercup family. And Native Americans use these plants as part of treatments for menopause.
Where does someone get that?
You could find it in most stores.
Is it a supplement?
It's a supplement. You can find it at most pharmacies. You can get it at natural food stores. And the way it works is it is not something that increases your estrogen level, but it somehow enhances the effect of the natural estrogen that's already in our body. That may be due to some effect on dopamine and serotonin. The mechanism isn't exactly well known.
And what about omega-3?
Omega-3 can be good in certain cases where women who are going through menopause may have issues with their cholesterol and triglycerides. But I always caution patients to use omega-3 with some advice. For example, there are omega-3s that are not necessarily the best brands, and they can actually increase your cholesterol, specifically your LDL cholesterol. So I always guide a patient as to when or not to use omega-3s.
And what about fatty fish? I read that fatty fish, certain types help symptoms.
So when you get vitamins and minerals, omega-3, whatever it is, through natural food sources, it's not going to have the same effect as I just discussed. So if you get it from flaxseed, from sardines, from the salmon, as you mentioned, then these are good ways of getting natural omega-3 into your diet.
And what role does exercise play?
Exercise plays a huge role because we know that it can reduce a lot of different things, like the depression, like the anxiety. It can actually even reduce the symptoms of the hot flashes and night sweats and improve your sleep quality as well.
I was also surprised to read how long women suffer, that some of the symptoms can last as long as 7 years.
That's correct, yes. And in my experience, and this is anecdotally from my own practice, I find that it's variable in terms of when it presents and how long it actually lasts for.
And what about pain during sex? Women don't like to talk about that.
Yes.
What's the best remedy for that?
So, different things. And having discussed this with different GYNs who actually specialize in this area, it can be as simple as organic coconut oil to certain lubricants.
Applied topically?
Applied topically to the vaginal area, to, there are various lubricants you can use. And then in more extreme cases, you can use topical estrogen to help with those types of symptoms.
And if women want to get a hold of you, where can they reach you?
I practice at Soma Medical Group in Berkeley Heights.
Berkeley Heights, New Jersey.
In Berkeley Heights, New Jersey, yes.
Yes.
And I've been there for 5 years, and my expertise is in women's health.
That's wonderful. So most of the women do come in to talk to you about things like this.
Yes.
Do you find any advances being made or anything in the future that we should know about that's coming out?
Well, there was one big study that's still very important to this day, and that was the Women's Health Initiative. It was a 15-year study that studied more than 160,000 women ages 50s to 70s. And it actually changed the way we practice medicine, specifically hormone replacement therapy. So before this study came out, and this was in the early 2000s, we used estrogen for a lot of women.
Right.
And this study changed everything because it showed that there was a slightly higher risk of breast cancer, higher risk of estrogen productive cancers like endometriosis
Right.
and endometrial cancer. And it also showed a higher risk of heart disease. Unfortunately, hormone replacement in this study actually improved osteoporosis, and it showed an improvement in reducing the risk of colon cancer, but we do not treat with hormone replacement for those two things.
Right. I was amazed to find how in the 90s, everyone was treated with that, and then they found increased risks for other things.
That's
so,
right.
It's better to take more natural approaches until there's something viable.
That's right.
Right. And brain fog, is it real?
It is very real, and I think a lot of us who have children, we go from brain fog from pregnancy to brain fog during menopause or perimenopause and menopause, and it's really not known how this mechanism occurs, but estrogen somehow plays a big role in it because estrogen is involved with the brain, and as our estrogen levels decrease, that's when the brain fog
So what
occurs.
can women do? Tie a ribbon around their finger to remember things, or I mean, it's a real concern.
It's
it is.
a real
it
thing.
is.
It's a real thing, and so writing things down,
Yes.
doing things to exercise the brain, which is
Yes.
exercise,
Absolutely.
cardiovascular exercise, and also doing things to keep your brain active as well.
Absolutely.
These are all important things.
And what's your website?
My website is drsomamandal.com.
Great. Thank you so much for being with us.
Thank you.
Great information. So it's Dr. Soma Mandal. That's Mandal, right?
That's right.
.com. It's a terrific topic. If you have any questions, you can list them below, and we'll make sure that Dr. Soma gets them. Thank you for joining us.